Good morning and welcome to the Department of Behavioral Health update it's the morning, which is unusual for me. I'm used to saying good afternoon, but we welcome you. And for those of you watching live, don't forget to put your questions in the chat. And for those of you who are watching this as a recording, remember that you can email us later with questions. All right, let's jump right in. I wanted to start today just reflecting on some work that's being done across the United States and in California around racism being a public health crisis. And yesterday we had the verdict, the guilty verdict, in the trial of Derek Chauvin for the murder of George Floyd. And as much as it feels great to know that justice has been served in that case in terms of a guilty verdict, please know that I see, as many do, that there's still so much more work to do. I'm grateful that that verdict came in guilty, and we have to continue down the path of dealing with the fundamental elements and environments and issues that created the situation that murder could occur. And so we are committed in the Department of Behavioral Health. I also want to call out the recent and ongoing acts of racism and violence against our Asian Pacific Islander community members and many other marginalized communities. We really have to stop the hate, stop the Asian hate, stop the hate against persons of color. And the department will continue down this path in partnership with our community, recognizing that only together can we make the changes to change the systemic structure, the structural parts of why racism continues to exist in our country, in our state, and in our community. All right, April is still Alcohol and Stress Awareness Month. Please watch your email box for some tips and such in recognition of that. And then I also wanted to mention that today is Administrative Professionals Day. We have quite a few positions in the department that support us in many different ways from an administrative professional perspective. Our office assistants, our administrative assistants, our executive assistants, and many other positions that provide support. I want you to know from my heart that I'll use Tina as an example. Tina is my right hand. She keeps me on track. She keeps me organized. It would be much more difficult to do my job without her support. And I've had different situations in my career where I've had support and didn't have support, and sometimes I had support that wasn't that great. And so when you have really good support, it really drives home to you that great relationship and the work of the administrative professional staff. And so I really want to call that out and recognize all of you today and the fabulous work that you do for the department in making us run. All right. So, COVID. COVID marches on. Over 142 million cases worldwide, now over 3 million deaths, another grim milestone passed this last week. In the United States, we're approaching 32 million cases of COVID, approaching 568,000 deaths. And in California, we now have over 3.6 million cases and approaching 60,000 deaths. And so continuing to have issues. Now, of note in California, we are down to a 1.3% positivity rate. And remember, if we can get under that 1% and stay there, that's where you really have the virus under control. Now, we'll have to pair that perception with continuing to test for COVID. If we really get below a certain threshold in testing, we won't be able to rely as much on that percentage. So we've got to keep those testing up, and we'll talk about that in a little bit. In terms of Fresno County, we now have over 100,000 cases, 100,702 cases, and 1,646 deaths. Remember, we did our mortality review last week and learned that probably it's possible that even more deaths were attributable to COVID, but that's what we have recorded. Yesterday we had 92 people in the hospital with COVID. In the county, 18 in the ICU. And while that's improving, it's still kind of going up and down. Just a couple days ago, we had 103. And a few days before that, we had 85. So we're still seeing fluctuations in that. But the really great news is that we have entered the orange tier officially. So if you look on the chart on the right-hand side, you'll see that we're at 2.9% positivity rate and 5.3 cases per 100,000. We want to get that down below 2. That's the goal. So we're in orange now, almost to yellow, but we still have a little more work to get to yellow. If we're in the orange tier, or if we can get into the yellow tier, we have to be in the yellow tier for 3 weeks in order to officially enter the yellow tier. But there are some good things happening as we enter the orange tier. I'll share with you one small example from our household. My daughter and my stepson and stepdaughter are all graduating this year. And my daughter's school was going to do a modified graduation. And just yesterday, they announced that they will do a regular graduation with some restrictions, don't worry. And it's outdoors. But there are some improvements and some loosening of restrictions. We're going to have to watch that super closely, though, as we watch these other metrics. And I'll talk about why that is in just a second. I did want to show you across the state, we are seeing continued movement to the orange tier. The top map shows you what we were last week, the bottom map this week. So we moved from red to orange, and a few other counties moved from red to orange. And we have the same number of counties in yellow. All right. In terms of vaccination, one of the ways we're going to get out of this mess, we're now over 600,000 vaccine doses administered. It's really remarkable that we've administered well over 500,000 doses in just a few short months. I think if you had asked us in December and January and even in early February, when we were only getting 7,000 or 8,000 doses a week, we would have felt pretty hard pressed that we could reach this milestone, but we are here. And 33.7% of our entire population has had at least one dose, and 44% of those over 16 have had at least one dose. In terms of over 65, we're now up to 78%. Last week that was 76, so that will creep up a little more slowly because we do have a remainder population that is comprised of individuals who refuse to get the vaccine or are hesitant to get the vaccine for some reason, as well as people who maybe have struggled to manage what they have to do to get the vaccine. Maybe they don't have access to the internet, they're not sure how to call, or they've called and they had to wait on hold too long, or they have difficulty being transported to a place to get the vaccine. So a lot of work is going on right now to identify that remainder population, particularly of that vulnerable elderly population. What can we do to get the vaccine to them? Do we make a home visit? What kind of facilitated supports can we provide them to get that appointment scheduled and get transport to there, or do we go to them? So rest assured that we won't stop trying to get that population vaccinated. We know they are at the highest risk collectively, as well as those with underlying health conditions. So we're really going to continue to work hard over the coming weeks and months to do whatever we need to do to make the vaccine available and give people the vaccine if they're willing to get it. All right. So what I want to focus on today is what's going on in the rest of the United States. We're seeing things come down here quite a bit. We have seen a little bit of a rise in cases across the United States. in hotspots. So there were some hotspots that began to emerge in our last surge. And those hotspots were in Michigan, Pennsylvania, New York, and New Jersey. And pretty much consistently, even at the beginning of COVID, we kind of saw that East Coast to West Coast. While there were some outbreaks in the state of Washington, how the surges have happened have really went from the East Coast to West Coast. So we're watching that very carefully. And when we first went into the third surge, we didn't see as much activity in that region. So most experts think that the rise is due to variants, some of the more infectious variants being prevalent in the areas where we're seeing that surge, as well as the younger population. And many of those were unvaccinated when more cases started to develop. Hopefully, as they begin to get vaccinated, as the vaccine becomes available to the younger population, we'll tamp that down. Also hoping that the younger population doesn't get hospitalized at as high a rate, although some reports are saying they're seeing an increase in hospitalization and death in a younger population. So that's something they'll watch really closely with the variants. And then pandemic fatigue. People are tired. They don't want to wear their masks all the time. They don't want to socially distance. They don't want to avoid crowds. They want to go out and go to restaurants and have a drink at a bar. And some municipalities like ours are loosening restrictions. Not all of the loosening of the restrictions is in line with guidance. So for instance, in California, at least we have some metrics that we're measuring and we're making decisions about the restrictions based on that. In some parts of the country, they're just making decisions that appear to be arbitrary. And so we'll have to watch closely and see if those loosening of restrictions can be tied back to an increase in COVID. They're also seeing a little bit of a role of school sports and the opening of restaurants in some areas. They're starting to see outbreaks on sports teams related to schools and school-age kids, and so that's something that they're watching. And then vaccine hesitancy and the scares we've had, like with the Johnson & Johnson and AstraZeneca vaccines. So some people are just reluctant to take the vaccine, and remember, that's the way we're going to get out of this, is to people either have to get COVID and develop antibodies that way, or be vaccinated against COVID and develop antibodies through the vaccination process. And right now, only 25% of the population is vaccinated. And really, all science will tell you that you need to get to 70 to 80% of the population either being vaccinated or having antibodies from having COVID, and we're just not there yet. We can't say that we're close to that. So this is kind of a gray period, a tenuous period where we're making so much progress with the vaccinations. And we have made a difference by having the restrictions, but people are getting tired of them. And as vaccinations increase, people think, well, now I can go out, or even if I don't take the vaccine, other people had it, so I'm going to quit worrying about it, or I'm just tired of the restrictions. So this is something we'll want to watch closely and hope that we can get past it through vaccination, hopefully. And then in the rest of the world, we are actually seeing an increase. More than 5.2 million new cases were recorded last week, the highest number of new cases since the pandemic began. And we've talked about this before. There are many, many parts of the world where no vaccine has been given at all. And many parts of the world, largely underdeveloped or undeveloped parts of the world, where they don't have the infrastructure of healthcare and hospitals to deal with a pandemic and or to give vaccinations. And so as the virus has spread to those areas, sometimes it's even hard to know what the case rate is because they may not even have the structure in place to do testing for COVID. So if there's no testing or unreliable testing being done, then you really can only look at hospitalizations and death rates. And if there's no hospitals there, then you're simply going to have people dying. And that's what we're beginning to see in parts of the world. Deaths increase for the 5th straight week. And that pace of deaths appears to be accelerating. And remember, as cases go up, deaths follow. And our cases are going up, but deaths are actually accelerating pace, which tells you that we're not even detecting all of the cases that are leading to the deaths. So one example I wanted to give you is India. India does have some health infrastructure, and it was kind of interesting. About a month ago, I was listening to a news article on the radio, a podcast, and they were talking about how India had a really low case rate, and they weren't really sure why that was. They were looking into it, doing some research. Well, now that case rate has increased significantly. They are experiencing their second wave, so they're a little behind us. They are experiencing over 220,000 cases daily. Now, India has a much larger population, about 4 times what the United States is. And when we've been in our peaks, we're, probably that many cases as well. And so we don't know, though, if all of their cases are being recorded. They are accounting, though, for a large portion of the overall world cases. Most hospitals there are full. I've seen pictures of this, but they're reporting that in some cases they have 2 people in a hospital bed. They are running out of beds, they are running out of oxygen, they are running out of drugs, and they don't even have room for the dead. I saw a very tragic video where they just, were in a situation where they had no place to put people who had died of COVID. And so it's really just underscores that we have to really think about what's happening in the rest of the world. They do think there's possibly what they call a double mutant strain there, so 2 of the concerning strains might have merged, and could that have created a more virulent or easier to catch virus, and or one that would cause people to get more sick or have a higher death rate. They are seeing more children impacted in India. And they also have some vaccine issues. They actually are producing 2 vaccines there. They are producing the AstraZeneca vaccine, and then they developed a vaccine there called Covaxin. But because they have so many people to vaccinate, they've actually at this point only vaccinated 1% of their population. So if you compare that to the United States, we vaccinated 25 times more of our population percentage-wise than India has done. And so, and they were going to provide some vaccine to that COVAX initiative. And remember, the COVAX initiative is the initiative where a conglomeration has come together with the stated goal of getting vaccine from countries that have more money or more access to vaccines or an oversupply of vaccines, and taking those vaccines to parts of the world that have no vaccine. And so India was going to provide some of that vaccine to the COVAX initiative, and they have not been able to do that yet. So India's in a really challenging situation right now, and the world is really looking at how this is not a situation where we say, well, we don't live there, that's not our problem, we shouldn't worry about that. Because again, with that really large population and COVID spreading, the chance that additional mutations of COVID will happen that might not be so great for the rest of the world is high. And so we really want to support as best we can. And I think I reported this last week, but President Biden is sending some of the extra vaccine we have to some countries like India. All right. The Johnson & Johnson pause, I wanted to talk about that briefly. The U.S. is still reviewing data. They are meeting on Friday, the FDA and CDC, as well as there's a Western states group that kind of supports California and some of the other states in the United States in the western part. And they're all meeting on Friday to really look at the data and make some decisions. Some of the early things coming out of those discussions is that the pause, at least in part, was to ensure that they could give good guidance on the treatment for this extremely rare complication. It's widely expected that after they meet, they will reintroduce Johnson & Johnson, because this complication is exceedingly rare. Remember, there's been a handful of cases out of 7.5 million doses given. And so likely a higher chance that someone would have a stroke from taking birth control pills, for instance, much, much higher than from getting the vaccine. And if we know that's a complication and we can watch for it and treat it, we can address it. And so just like with anything else, we all get in our cars every day. There's a risk that you could get in a car accident and injured or die, but we weigh those risks and benefits. So I know I need my car to get to work, I need my car to go to the grocery store, the doctor's office, take my kids to school. So I've weighed that, and then I have some practices I can do. I can drive safely, the speed limit, wear my seatbelt, have good situational awareness, and increase my chances that this risky endeavor will not result in my injury or death or someone else's injury or death. And the birth control pill is another example. I took the birth control pill before I was ready to have kids, and that had a risk associated with it. We all see those labels or leaflets that come with medication we take, or you watch an ad on TV, and in that fine print are all the possible complications, and they almost always say including death. So there is measured risk in almost everything that we do, particularly as it relates to medicine and a vaccine or medical treatment, and vaccine is considered medical treatment. So I really want to emphasize to you that yes, there is a risk associated with the Johnson & Johnson vaccine. It's exceedingly rare, and it is treatable, and it's much less likely to happen than many other choices we make. And it is much less likely to happen than that the person could get COVID and die. And so I do believe that they will end the pause for Johnson & Johnson, and we will resume giving Johnson & Johnson. The European Union has already made that decision. They said it's an extremely rare risk. They recommend a warning label, which Johnson & Johnson has already said that they would do, and they have determined that the benefits outweigh the risks. So I do think that that is the direction the United States will go as well. But that's just my opinion. That's not a fact. So time will tell. All right, so we are going to resume our vaccine clinics next week on Tuesday and Thursday for the people that we serve. At this point, we'll be working with one of the 2-dose vaccines. If something happens on Friday and the Johnson & Johnson can resume, it's possible we'll go to Johnson & Johnson. But if we go to the 2-dose vaccine, then we will schedule the person for both appointments. All right, and that's pretty much the end of my presentation today. We are continuing to work on the plan. It does take a little bit of time to do what we've talked about doing, but I do, again, commit to you that we will have a plan in place, and we will give you notification prior to really getting back to normal, where most people are working in the office and we're able to offer in-person treatment to the people we serve. So with that, I'm going to look at the questions, and there are none. I'm not sure if I have any questions via text, given that we had to shift this to the morning. That may be part of it. So please, again, if you're watching this and you think of something that you want an answer to, do not hesitate to email me. I actually like to get those questions. Sometimes I learn things when I do research into your questions. It's one of the best things about my job in doing this presentation is that I've got to go back to being a student and learn a lot. And I like learning, so that's great. And I like teaching too, so hopefully you're getting some benefit from learning more about this pandemic that we're going through, and I will see you next week.